As Glastonbury 2025 approaches, the air is buzzing with anticipation. Fans from all over the world are preparing for what promises to be an unforgettable weekend of music, art, and togetherness. The iconic Pyramid stage is set to host legendary acts, and the fields of Somerset will soon be alive with the energy of over 200,000 festival goers. For many, Glastonbury is the highlight of the year, a place to make memories, meet new friends, and celebrate the power of live music. But this year, there's a shadow hanging over the festivities. Health experts have sounded an urgent alarm. Glastonbury could become a hotspot for a major measles outbreak. With so many people gathering in close quarters, the risk of the virus spreading is higher than ever. Public health officials are especially concerned because measles is one of the most contagious diseases known, and it can spread rapidly in crowded environments like music festivals. England is currently experiencing its worst measles outbreak in more than a decade. Hundreds of cases have already been reported this year, and the numbers are rising. With Glastonbury's massive crowds, the potential for the festival to become a super spreader event is very real. The virus can linger in the air and on surfaces, making it easy for even a single infected person to unknowingly pass it on to dozens of others. That's why health authorities are urging everyone planning to attend to take one simple but crucial step. Check your MMR vaccination status before you pack your bags. The MMR vaccine protects against measles, mumps, and rubella, and it's the best way to keep yourself and others safe. If you're not sure whether you've had both doses, now is the time to find out. It only takes a moment to check your records, but it could make all the difference. Taking this quick precaution could be the difference between a festival remembered for its incredible performances and one overshadowed by a public health emergency. No one wants to see Glastonbury in the headlines for the wrong reasons. By making sure you're protected, you're not just looking after yourself, you're helping to protect everyone around you, especially those who can't be vaccinated for medical reasons. The MMR vaccine is safe, effective, and widely available. It's been used for decades to prevent outbreaks and save lives. If you need a dose, it's easy to arrange through your GP or local health clinic. Getting vaccinated now means you can enjoy the festival with peace of mind, knowing you've done your part to keep Glastonbury safe for everyone. Let's make sure Glastonbury 2025 is remembered for its spirit of community, joy, and music, not for a preventable illness. By checking your vaccination status and encouraging your friends to do the same, you're helping to protect the festival and everyone who makes it special. Together, we can keep the music playing and the memories positive for years to come. Measles isn't just a childhood rash. It's one of the most contagious viruses known. One infected person can spread it to 9 out of 10 unvaccinated people nearby, just by breathing, coughing, or sneezing. Early symptoms mimic a cold fever, cough, runny nose, red eyes. Then comes the rash. Crucially, you're contagious days before the rash appears, unknowingly spreading the virus. Complications can be severe: pneumonia, brain swelling, even death. Rarely, measles can cause fatal brain disease years later. Vaccination is the only reliable way to stop this dangerous virus. Glastonbury's magic comes from crowds, music, and shared experience, but these also make it a perfect storm for measles. 200,000 people packed together means the virus can spread fast. Festival life, close quarters, little sleep, and constant mingling weakens defenses and increases risk. Someone could arrive feeling fine, unknowingly contagious, and infect hundreds before symptoms show. After the festival, attendees disperse nationwide, potentially spreading measles far and wide. This isn't just a local issue. It's a national public health concern. Preventing an outbreak at Glastonbury is critical. England is currently facing its most severe measles outbreak in more than a decade, sending shockwaves through communities and putting immense pressure on the country's healthcare system. Already, hundreds of cases have been reported in just the first few months of the year, and the numbers are climbing at an alarming rate. Hospitals are seeing a surge in patients, and emergency rooms are struggling to keep up with the influx. Health officials are sounding the alarm, warning that this outbreak could get even worse if urgent action isn't taken. The situation is being described as a public health crisis, with doctors and nurses working around the clock to contain the spread and care for those affected. The southwest of England, famous for hosting the world-renowned Glastonbury Festival, and the bustling city of London, have emerged as the main hotspots for this outbreak. These regions, known for their vibrant communities and large gatherings, are particularly vulnerable to the rapid spread of infectious diseases like measles. Crowded events, busy public spaces, and high population density make it easier for the virus to jump from person to person. Public health teams are focusing their efforts on these areas, trying to track cases and prevent further transmission. But the challenge is immense. The majority of measles cases are being seen in children who have not received their full course of vaccinations. However, it's not just young children who are at risk. Teenagers and young adults, especially those who may have missed their childhood jabs, are also vulnerable to infection. Schools, colleges, and universities are on high alert, with health officials urging parents and students to check their vaccination records. Clinics are seeing long lines of young people seeking protection, and nurses are working tirelessly to administer vaccines and provide information about the importance of immunization. The dangers of measles are not limited to children. Recent tragic deaths in the United States have highlighted that measles can be deadly at any age, even for healthy adults. Complications such as pneumonia, brain swelling, and long-term disability are real risks. Doctors are urging everyone, regardless of age, to take this outbreak seriously. Families are being reminded that measles is not a harmless childhood illness. It can have devastating consequences for anyone who is not protected. To stop the spread of measles, experts say that at least 92 to 95% of the population needs to be fully vaccinated to achieve herd immunity. Unfortunately, the UK is currently falling short of this crucial target. Month after month, the number of cases continues to rise, especially in April and May, as shown in recent data. Public health campaigns are ramping up, with the NHS urging everyone to check their vaccination status and get their jabs if they haven't already. The gap between the herd immunity threshold and actual vaccination rates is leaving the country exposed to further outbreaks. Shockingly, 1 in 5 children in England are not fully protected against measles. This means that thousands of children are at risk of catching and spreading the virus, creating dangerous gaps in community immunity. Parents are being urged to make sure their children are up to date with all recommended vaccines. Doctors' offices and clinics are seeing a surge in appointments as worried families seek to protect their loved ones. The message from health professionals is clear. Vaccination is the best defense against measles. Measles is a highly contagious virus, and it is now exploiting the immunity gaps left by falling vaccination rates. The virus can spread rapidly through communities, putting vulnerable people at risk. Now is the time for action. By getting vaccinated, we can protect ourselves, our families, and our communities from this dangerous disease. Health officials are urging everyone to check their vaccination status and help stop the outbreak before it gets even worse. The MMR vaccine is your shield against 3 serious diseases: measles, mumps, and rubella. It's a simple, safe, and effective way to protect yourself and those around you from illnesses that can have life-changing consequences. Measles, for example, is not just a childhood rash. It can lead to severe complications like pneumonia, brain inflammation, and even death. Mumps can cause painful swelling, and in some cases, long-term health problems. Rubella, while often mild in children, can be devastating for pregnant women and their babies. The MMR vaccine is our best defense, offering robust protection in a single shot. With just 1 injection, you're protected against all 3 diseases. The vaccine has been rigorously tested and used worldwide for decades, proving its safety and effectiveness. It's a cornerstone of public health, helping to keep outbreaks at bay and communities healthy. 2 doses of the MMR vaccine provide up to 99% lifelong immunity. That means you're not just protected for a few years, you're safeguarded for life. Even if you missed your childhood vaccinations, it's never too late to catch up and secure your health. Since its introduction in 1968, the MMR vaccine has prevented millions of cases of measles, mumps, and rubella in the UK alone. It saved thousands of lives and spared countless families from the heartbreak of serious illness. Thanks to vaccination, diseases that once caused widespread suffering are now rare. But vaccination isn't just about personal protection. It's about community. Some people, like newborns, those with weakened immune systems, or people undergoing certain medical treatments, can't be vaccinated. When you get your jab, you help create a protective barrier, shielding the most vulnerable among us from harm. If you're unsure whether you've had both doses, don't worry. The NHS makes it easy to check your vaccination status and get protected. The MMR vaccine is free for everyone, no matter your age. Whether you're a student, a parent, or a grandparent, it's never too late to get vaccinated and join the fight against these preventable diseases. Even a single dose offers strong protection, but 2 doses are best for lifelong immunity. If you've only had one, make sure to get your second for maximum defense. It's a quick, simple step that can make a world of difference. Planning to attend a big event like Glastonbury? Make sure you're fully protected by getting vaccinated at least 2 weeks before the festival. This gives your body time to build up immunity, so you can enjoy the music and the crowds with peace of mind. Your decision to get vaccinated doesn't just protect you. It helps keep Glastonbury, your friends, and your entire community safe. Together, we can stop the spread of measles and keep the good times rolling for everyone. Why are so many still unprotected? A debunked study in the 1990s falsely linked MMR to autism, causing vaccination rates to plummet. Many young adults, prime festival goers, missed their jabs, leaving immunity gaps. Some missed vaccines due to moving, busy lives, or lost records. The current outbreak is a direct result of these gaps. The NHS message is clear. It doesn't matter why you missed out. Get protected now. The vaccine is free, safe, and easy to access. Closing the immunity gap is essential for everyone's safety. With Glastonbury near, take action now. Check your vaccination status. Look in your Red Book or call your GP. If you're missing a dose or unsure, book your free MMR jab immediately. The vaccine needs 2 weeks to work, so don't delay. Even 1 dose helps, but 2 is best. By getting vaccinated, you protect yourself and everyone around you. Make this part of your festival prep, just like packing your tent. A quick call today could make all the difference. If you feel unwell before Glastonbury, fever, cough, runny nose, red eyes, don't go. It could be measles. Staying home protects thousands. If you get sick at the festival, seek medical help immediately. Don't try to tough it out. Isolate yourself and tell medical staff your symptoms and concerns about measles. After the festival, watch for symptoms for 2 weeks. If you get sick, tell your doctor you attended Glastonbury. This helps public health officials track and contain any spread. The same advice applies for any infectious illness. Sensible decisions keep the festival and your community safe. The measles warning isn't cause for despair, it's a call to action. Glastonbury's spirit is about looking out for each other, and this year, that means checking your vaccination status and getting protected. Stay home if you're sick and encourage friends to do the same. These simple steps create a shield of collective immunity. By acting now, we protect the festival's magic and the most vulnerable among us. Let's make Glastonbury 2025 about music, joy, and community.